Okay, so hi, Kate. I'm Leonard Alvier, student today, nurse practitioner. All right, so we're going to start out with the head, ears, eyes, nose, and throat exam. And what I'm going to do is first I'm going to inspect her skin, looking for any color, temperature, moisture, texture, edema, turgor, bruises, scars, lesions, and nevi. And everything looks great. And I'm going to inspect her head for size, symmetry, and midline position, and everything looks fantastic. And I'm going to inspect the head and scalp for hair color, distribution, texture, as well as lesions, masses, tenderness, depressions, and infestations. And again, everything is perfect. I'm going to palpate the temporal arteries for tenderness. Any pain with that?
No.
I'm going to palpate the lymph nodes, starting with the preauricular, postauricular, occipital. Can you unzip this for me?
Sure.
We're going to go to anterior cervical. Posterior cervical, supraclavicular. Okay, good. Now I'm going to go down to the ears. I'm going to inspect the shape and place, position of the ears. They look great. I'm going to inspect the auditory canal. Up and back. Looks good. Looks good. I'm going to palpate the pinna and tragus to see if there's any masses or tenderness. Any of this hurt?
No.
Okay, same thing. Okay, good. I'm going to move down to the eyes. I'm going to inspect the lashes, the brows, and palpable fissures. Good. I'm going to inspect the conjunctiva and sclera. Good. I'm looking for color, lesions, and discharge. And I'm going to inspect the red reflex. Okay. Okay, and any other internal eye structures. So go ahead and just look here at the eye wash station. Good, I'm going to come in, look for other internal eye structures. Good. Good. I'm just going to do this one again using this eye. Good. I'm going to let's see, I did the, okay, now I'm going to move down to the nose. I'm going to inspect that the nose is straight and in the midline position, and it is. I'm going to assess for nasal patency. So I'm going to go ahead and occlude this nostril. Go ahead and breathe out of the other one. Everything okay? Good. I'm going to occlude this one. Breathe out the other. Everything's okay?
Yes.
Good. I'm going to palpate the frontal and maxillary sinuses. Any tenderness in there?
No.
Okay, good. Now I'm going to inspect the mouth, the lips, the gums, teeth. Good. Say ah. Good. Looking through there. Let me get my pen light. Good. Lift your tongue up. And lift your tongue up. Good. Posterior pharynx, buccal mucosa. And the tonsils, I'll grade them as a 0. Not visible. I'm going to check the TMJ. Tell me, do you have any tenderness, crepitus? No. And no signs of subluxation. Okay, now I'm going to inspect her neck, looking for color, temperature, moisture, texture, edema, turgor, bruises, scars, lesions, and nevi, and everything looks great. And I'm going to palpate for the thyroid gland. Go back, cricoid cartilage. Okay, go down. Okay, go and swallow for me. Good, I can feel it move up and down on my fingers. Thyroid's great. Okay, now I'm going to move down to the musculoskeletal exam. So if I could have you take off this jacket. Thank you. Okay, so we're going to start out by checking the range of motion of your neck. You can sit down, that's okay. Thank you. Check the range of motion of your neck. So I'm going to have you flex your chin down, extend your head back, hyperextend your head back as far as you can go. Laterally bend, bring your ear down to your shoulder. Other side. Good. Now turn your nose towards your shoulder and the other side. Okay, good. Very good. Now I'm going to assess the overall upper extremity, looking for warmth, color, skin integrity, and then assess for any signs of edema. And she has great color, or great warmth and color, a good skin integrity, and there's no signs of any edema. Okay, so now I'm going to inspect and palpate the fingers, the joints, looking for any redness, swelling, deformity, tenderness, nodules, crepitus, or symmetry. Good. Good. Okay, good. Now we're going to check the range of motion of your fingers. So I'm going to have you actually put your fingers up like this. We're going to have you flex, extend, hyperextend. Okay. And you're going to do ulnar deviation, radial deviation, and rotation. Okay, good. I'm going to have you squeeze my second and third fingers against resistance. Good, it's a 5 out of 5. And next I'm going to move up to your wrist joints. I'm going to inspect and palpate the wrist joints for redness, swelling, deformity. Looks good. Looks good. I'm sorry, I'm going to go back to the fingers. I didn't do the range of motion. Right, so we're going to do it again. So we're going to do flexion, extension, hyperextension, abduction, adduction, and thumb opposition. Very good. Okay. Now we just check the wrist joints for redness, swelling, deformity. Everything looks great. Now we're going to check the wrist range of motion. So we're going to go flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Okay, great. I'm going to inspect and palpate the elbow joints, looking for redness, swelling, deformity, tenderness, nodules, crepitus, and any problems with symmetry. And it looks great. I'm going to check the range of motion of the elbow joint, flexion, extension, hyperextension. Good. I'm going to test the biceps and triceps against resistance. Bring your arms up. Bring your hands this way. Don't let me pull, okay? Good. Don't let me push. Good. Biceps and triceps tendons are intact. It's 5 out of 5 for both of them. You can relax there. I'm going to inspect and palpate the shoulder joints, looking for redness, swelling, deformity, tenderness, nodules, crepitus, and any problems with symmetry. Good. We're going to check the range of motion of the shoulders. So I'm going to have you arms up. And then you might actually need to move over here. Let me just check the camera. Should see you. Okay. Flexion, extension, hyperextension, abduction, abduction. Good. Internal rotation. And then do the other hand. Good. Then arms out like this. External rotation. Very good. Now we're going to circumduction as well. Okay, great. All right, so here, you come back here, please. And now we're going to test abduction and adduction against resistance. So bring your arms up. Okay. Don't let me pull. Good. I'll bring them across here. Don't let me pull. Good. Abduction and adduction are 5s out of 5. Very good. Now we're going to assess the lower extremity, the overall warmth, color, skin integrity, and any signs of edema. So if you could take off your sweatpants for me, please. And you can, there you go. Thank you, thank you. Okay, so she looks like she has good warmth, good color, great skin integrity, and no signs of edema. Okay, so I'm going to start by inspecting and palpating the bones of the toes, looking for redness, swelling, deformity, tenderness, nodules, crepitus, and any problems with symmetry. I'm going to go ahead and take your socks off. Okay, good, looks good, good, good. Okay, we'll check the range of motion of the toes, flexion, extension, hyperextension, abduction, adduction, good. Okay, now we're going to inspect and palpate the ankle, looking for redness, swelling, deformity, tenderness, nodules, crepitus, and any problems with symmetry. And they feel great. So we're going to assess the range of motion of the toes. Go ahead and dorsiflex into my hand. Well, dorsiflex up. Plantar flex down. Inversion. Eversion. Rotation. Good. Now we're going to assess against resistance. Press into my hand. Good. Press into my hand. Good. Resistance is 5 out of 5. I'm going to inspect and palpate the joints of the knee, looking for redness, swelling, deformity, tenderness, nodules, crepitus, and symmetry. And everything looks great. No problems there. Then we're going to assess against resistance. Flexion, pull into my hand. Push into my hand. Extension, good. It's normal. Now we're going to assess against resistance the hips. So we're going to check for abduction, push into my hand. And adduction, pushing in. Good. Well, all are 5 out of 5. I'm going to have you stand up, maybe over here. Okay. And I'm going to inspect and palpate the hip joint, looking for redness, swelling, deformity, tenderness, nodules, crepitus, and symmetry. And everything is great. We're going to assess the range of motion of the hip, flexion, extension, hyperextension. Good. Internal rotation, external rotation, abduction, adduction. Okay, other foot, internal rotation, external rotation, abduction, adduction, and circumduction. Okay, good. And we're going to assess the range of motion of the knees. So we're going to go flexion, extension, hyperextension, good, other leg, flexion, extension, hyperextension, perfect. Okay, now we're going to assess the spine and the alignment and normal curvatures. Okay, so she has a normal thoracic kyphosis, normal lumbar lordosis, so we're going to have you check your range of motion of the spine. So, flexion, extension, hyperextension, good, lateral bending, and rotation. Okay, good. I'm going to have you flex forward. We're going to check your spine for scoliosis in the flexed position. Good. Okay, making sure everything's nice and straight, all the spinous processes, and she's perfect. Okay, so that's the musculoskeletal exam. Now we're going to do the cardiovascular exam. And I'm going to start out by palpating the carotid artery. Good, making sure I do just one side at a time. Good, and I'm going to auscultate for bruise. Make sure you can see. Okay. Okay, good. I'm going to auscultate in the heart area with both the bell and diaphragm. Okay. This is the aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to switch over to the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, so now I'm going to have the patient lay back. Wait a minute, all the way back. Sorry, it's kind of cold. Alright, so I'm going to inspect for any heaves or lifts, and I don't see any. I'm going to palpate for thrills of the areas that I've just auscultated. And I don't feel any. I'm going to go ahead and auscultate over these same areas again. Aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, now I'm going to palpate and locate the PMI. So I'm going to have you turn to your left a little bit. Okay, and it should be off the 5th intercostal space. And then you move this arm over. Okay, there it is, 5th intercostal space, about 7 centimeters over. And I'm going to listen to it for a full minute. Get this clock where I can see it. Okay. Alright, it's just normal rate and rhythm, so go ahead and lay flat on your back. I'm going to lift the table up a little bit so you can just relax there. There we go. So we're going to bring the head of the bed up 30 to 45 degrees. I'm going to have you look up and away. I'm going to assess for jugular venous distension as well as pulsations. go ahead and look over this one. Very good. Then you can look just normal. And everything looks fantastic. All right, so now I'm going to go down to the abdomen and assess for any bruits. So we're going to auscultate for any bruits. We're going to listen to the aorta. Renal. Iliac. And femoral. And I can only hear normal vowel sounds. Now we're going to check cap refills. So can I see, just want to turn it over this way. Okay. Cap refills normally take about 2 seconds to refill. And she's perfect. I'm going to assess the radial pulses. Great. Check the cap refill on the toes. Good. Very good. I'm going to check the dorsalis pedis pulses. And the posterior tibial pulses. Excellent. Okay, that's the cardiovascular exam. You can go ahead and sit up. There you go. Thank you. And now we're going to move to the respiratory exam. So I start off by inspecting her neck, looking for color, temperature, moisture, texture, edema, turgor, bruises, scars, lesions, and nevi, and everything looks great. And I'm going to palpate the trachea to make sure it's in the midline position. And it is. I'm going to move around to the posterior chest. And first I'm going to inspect the skin, looking for color, temperature, moisture, texture, edema, turgor, bruises, scars, lesions, and nevi. I'm going to inspect for any signs and symptoms of respiratory distress, as well as any obvious signs of deformity and normal symmetry. So go ahead and take a deep breath in and out. Good. I'm going to go ahead and palpate for symmetrical chest expansion. Take a deep breath in. Good. Again. Good. One more time. Okay, good. I'm going to palpate for tactile fremitus. You can say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
And 99.
99.
Very good. I'm going to percuss over the posterior lung fields. As well as the lateral lung fields. Good. I'm going to auscultate the posterior lung fields. So whenever you feel my stethoscope touch your back, I want you to take a deep breath in and out. Good. Okay, now when you feel my stethoscope touch you, I want you to say the words 99.
99. 99. 99. 99. 99. 99.
Okay, I can hear it as normal as can be. Now I want you to go ahead and whisper 99. Okay, good. I can see your lips moving, but I couldn't hear anything. Now I want you to say E when you hear my, feel my stethoscope touch your back.
E, 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 E.
Perfect, okay. I didn't hear anything change to an A, I just heard E. Everything's very normal. Now I'm going to move around to the anterior chest. I'm going to inspect the anterior chest for color, temperature, moisture, texture, edema, turgor, bruises, scars, lesions, and nevi, and everything looks great. Any signs of obvious deformity as well as normal symmetry. So go ahead and take a deep breath in. And good. I'm going to go ahead and palpate for symmetrical chest expansion. Deep breath in. And out. Good. Okay, 99.
99, 99, 99, 99.
Good. Now I'm going to go ahead and auscultate the anterior lung fields. So when you feel my stethoscope, take a deep breath in. Okay, very good. That's the respiratory exam, and now we're going to move over to the neurological exam. So we're going to start with the Snell and Eye chart, which is over here. So I'm going to go ahead and have you cover your right eye with your right hand, and whenever you're ready, read the lowest line that you can read on there.
F-E-L-O-P-Z-D.
Great. Now go ahead and cover the left eye with your left hand, and whenever you're ready, go ahead and read the lowest line that you can read.
F-E-L-O-P-Z-D.
Very good. She's shown a visual acuity of 20/20. And now we're going to go ahead and check your visual fields. So I want you to cover your right eye with your right hand. I'm going to cover my opposite. When you see my fingers come into view, I want you to tell me when you see them moving into view.
Right now. Right now. Right now. Right now.
Good. I want you to go ahead and keep, we're going to cover the other eye. Good. Same thing. And when you see my fingers come into view.
Right now. Right now. Right now. Right now.
Good. Okay. And now I want you to go ahead and stare at me, and I want you to tell me which finger you see moving. Your right, left, or both. Okay?
Left. Right. Right. Both.
Good. Okay, I want you to stare over my shoulder at the eye wash station. And when I say go ahead and look at my finger, go ahead and look at my finger. Okay, look back. And when I say look at my finger, look at my finger. Okay, go ahead. Okay. So the pupils constrict, the eyes converge. Very good. Now we're going to check for direct and consensual light response. Okay. Come on, buddy. Just put new batteries in this today. That should be working. Okay, hang on 1 second. It was just working when I came here. Come on. Okay, well, my pen light isn't working right now, so I do have, this little tweezer light, so I'll keep the tweezers away from her eye, but this is just to see if the eyes go ahead and constrict, and the pupil constricts. Then we'll see if the opposite pupil constricts. Very good. And same thing. Pupil constricts, and the opposite pupil constricts as well. Okay. Now we're going to go ahead and check for any extraocular movements. So I want you to follow my finger, and in the 6 cardinal fields of gaze, just stay with my finger, don't move your head, just your eyes. And I'm looking for any sort of lid lag, nystagmus, any double vision. Any problems with double vision?
No.
Okay, everything's perfect. And just follow my finger. Good. Okay. All right, now we're going to check cranial nerve 5. So go ahead and clench your jaw for me. Good. Don't let me open. Good. Open. Don't let me close. Good. Now we'll check the sensory portion of that. I have this Q-tip, so this is soft and sharp. Okay, so I want you to tell me which is soft, which is sharp. Go ahead and close your eyes.
Soft, sharp, soft, sharp, sharp, soft, sharp, sharp.
Very good. Okay, now we're going to move on to cranial nerve 7. Go ahead and smile, frown, lift your eyebrows, puff out your cheeks, purse your lips. Very good. Cranial nerve 7 is intact. We're going to check for hearing, so I'm going to go ahead and whisper in your ear. I want you to tell me what I say.
W,
Good.
76.
Very good. Okay, if I was worried that there was a problem with his hearing, what I would do is I would do Weber's test. So I'm going to go ahead and put this up here. Tell me, do you hear the sound more on one side or is it equal in both?
Equal in both.
Okay, good. I can also do Renee's test. So I'm going to put this up here on your ear. You tell me when it stops vibrating, and then you tell me if you can still hear it over here, okay?
Stopped.
Just there? Yeah, good. Excellent.
Stopped.
Okay, good. All right, so we're going to go to cranial nerve 9 and 10. So go ahead and say ah.
Ah.
Good. The roof and the uvula move up, and they're in the midline position. Raise your shoulders up. Don't let me push. Don't put your hands there. Just lift your shoulders. Good. And stick out your tongue. And go right and left. Good. Tongue comes out in the midline. No signs of fasciculations. Okay, now we're going to assess the overall upper extremity for any sort of light touch sensation loss. Okay, so tell me, does any of this feel unusual, different, heavy? No, it's all good? Okay. So what I'm going to do is I'm going to put something in your hand. I want you to tell me what it is. Okay, so close your hand, turn your hand over. Go ahead and feel that. Tell me what you think that is.
Paper clip.
Paper clip. Okay, good. And what is this?
Keys.
Keys. Okay, good. All right, now I'm going to go ahead and draw something in your hands. Keep your eyes closed. I want you to tell me what I'm drawing.
8.
8. Very good. And one more.
7.
7. Okay, good. All right. Now we're going to go to the vibratory sense. So turn your hands over. So you'll feel it vibrate. Or you might feel nothing.
Okay.
Okay, so close your eyes. Tell me what it is. I'm going to do it on the ulnar prominence.
Vibrate. Nothing. Vibrate. Nothing.
Good. Okay, go ahead and turn your hands over. I want you to do with your fingers what I'm doing with mine. Good. Okay, I want you to do this. And switch hands. Good. Fingers out in front of you, make them touch together. Perfect. Okay. Now I'm going to check your the deep tendon reflexes. Okay, so we're going to go here with your brachioradialis. Good. And then you're going to hold your arm here. Go ahead and relax. Alright. And let this guy go right there. Triceps. Good. We'll do the same thing over here. Good. Good. And triceps. Good. Okay, we're going to have you scooch forward just a little bit. Okay, and relax these guys here. We're going to check your patellar. Good. Achilles. Let this go. Good. And we're going to check Babinski's, going from lateral to medial. She's ticklish. Good. Very good. Okay. That is, we're going to move down to the lower extremity. I'm going to assess the light touch sensation for the lower extremity. Tell me, does any of this feel different
No.
at all? Okay, good. I'm going to do vibratory sense on the medial malleolus. Okay, same thing as the upper, vibrating or not, you tell me.
Vibrating. Not. Vibrating. Not.
Perfect. Okay, I'm going to have you stand up right over here. Put your feet together for me. We're going to do Romberg's test. Okay. So you stand still for a second. I'm going to watch you. Make sure you can stand up straight. Okay, and when you're ready, I'm going to have you close your eyes for just about 20 seconds. Okay? And I'm right here in case you fall. I'll catch you.